Hey guys, it's Rachel. I'm going to be doing my phlebotomy video. Prior to getting to the patient, I would make sure that I do have all of the necessary equipment to do the job successfully. So in this case, I have my needle with a safety device, tourniquet, alcohol pads, my tape, cotton balls, gloves, my sharps container. I would have a towel or chucks to bring to put underneath the patient's arm, and enough tubes to do the job to fulfill the order. The facility that I work at does use the vacuum tubes, but if they didn't, I would make sure that I had enough syringes and transfer devices to transfer the blood once I'm finished collecting it. Hi there.
Hi.
How are you?
I'm good, I think.
Good. My name is Rachel. I'm going to be the nurse taking care of you and drawing some blood from you.
Okay.
Can you tell me your name and date of birth?
Yes, it's Patricia Kelly, 8/30/1957.
Perfect. That matches. Okay, so the doctor did order me to take some blood from you.
Okay.
I am going to have to withdraw 4 tubes from you.
Okay.
Because you do have an IV in your right arm, I am going to use your left arm.
It's okay.
Have you had your blood drawn before?
Mm-hmm.
Did you have any problems or pain?
No.
Okay. Are you afraid of needles?
No.
Okay. So prior to getting started, I would wash my hands. In a patient's room or setting, I would ideally use soap and water. In this case, hand sanitizer. Put my gloves on. So I'm going to put the tourniquet about 4 to 6 finger widths above the anacube. This is going to be a little tight.
Okay.
Okay. And if you want to just relax and do your hand to a fist a couple of times. Perfect. So I'm going to clean the area using an alcohol pad. I'm going to go in a concentric motion for 2 centimeters, working from in to out. And I will allow that to dry completely. For our orders, I have 2 light blue tubes, one for the discard and one for the actual sample that's collected, a gold top tube, and my purple tube. In the light blue tubes, I am collecting the prothrombin time. The gold tube has the troponin and the CMP. The lavender has the CBC that is ordered. Once that is dry, do you have any questions before I...
No, I don't think so.
Okay. I'm going to just go ahead and relax. With my non-dominant hand, pull the skin tight, or at least taut. And then with the needle, go in at a 30-degree angle with the bevel pointed up. You're going to feel a little prick, okay?
Okay.
So, 1, 2. And then I will know I'm in once I've gotten the flash. And when I'm in, I will attach my first tube. So this is the first light blue tube. That is the discard with 1 to 2 milliliters of blood. This is the sample tube. And so I will fill that to the indicated line. Gold top. And then once I have what I need for the gold top tube, I'll invert it gently 3 to 5 times. This helps mix what's in the bottom, the serum, with the blood. But I won't do it vigorously so I don't cause the blood cells to hemolyze. And then with the lavender top tube, I will fill that to ensure I have enough. Once I have all of my tubes filled, and prior to removing the needle, I will get a cotton ball in my left hand, get it at least by my left hand, release the tourniquet, and then I will withdraw the needle, quickly place the cotton ball over the site, cap my needle, and throw it in the sharps container. I would ask my patient if they are able to hold pressure on the cotton ball. In this case, her right arm is hooked up to her IV and doesn't have much slack, so I will tape it for her. Perfect. And then once I have my specimens, I'm going to remove my gloves, wash my hands, and I label the tubes. So I'd put a new pair of gloves on. I'm a little OCD about things, but that's just me. And I'll label each tube with her name, the date, which today is the 28th, and the time is 12:12. My facility does also require my initials to be